centuries. I salute all my ancestral gurus of this tradition, starting from Vaidya Ituri Krishan Nambudiri, and now our chairman and my guru, my guiding force, Dr. Ituri Bavadasan Nambudiri, is the guru, and also Swami Narayanji Maharaj. I salute all these great physicians, all these Ayurveda Shalakis before delivering my presentation. So, Aushadha Yogas in Netra Chikitsa, its concepts and practices. What is Aushadam? There are two aspects, Aushadam and Yoga. Yoga. Both the words are very familiar to us. What is Aushadam and what is Yoga?
Sir?
Hello?
Sir,
Yes.
excuse me, sir. Hello?
Yes.
Sir, the sound is not that audible. It is a bit feeble.
Okay. I will try. Sound is not. Ocean. Can you hear now?
Yes, sir, we can hear, but it is a bit feeble. A little bit feeble.
Okay. I will try. Osham Roga Bayam Jayati Idi Aushadam. That which relieves the bhaya or the fear of the disease is called Aushadam. Roga Bhayam Jayati Idi Aushadam. So, the concept of Aushadam. Now, we all are in a situations handling the pandemic, COVID-19 pandemic, and everywhere you can see a fearful condition as the Janapadodvamsa is happening that time. There is a Roga Bhayam or the fear of disease is increasing day by day. So the Aushadha is indicated or Aushadha is meant for overcoming this Roga Bhayam. Here we can use different dravyas, its combinations, and not only the dravyas, many adravya chikitsa and different kinds of treatment modalities Ayurveda is using in as Aushadha. So, the fear of disease, the pandemic, now this word is very familiar. This word is very familiar to everybody. Break the chain. So, in this pandemic, how we are managing this pandemic, the concepts of the drug identifying concepts or new drug development concepts during this pandemic is day by day we are reading in our newspapers or medias. That is, for example, to manage the COVID-19 or coronavirus, we are using different approaches. For example, anti-malarial drug. Hello? Am I audible? Am I audible? Hello?
Yeah, doctor. Hello. Yeah, we can try.
Okay.
Yeah.
Okay. So, different types of approaches to develop a drug, to develop a molecule, some modification over the concepts. All this we are witnessing during this pandemic situation. Why I am emphasizing this in this context is, so the break the chain of disease, break the chain, delinking the chain is the aim. For that, we are trying anti-malarial drug antiviral drug, anti-inflammatory drug, steroidal drug, many angles we are using to develop a new molecule or to discover a drug against this pandemic. So here also in our Shalakya Tantra, we need many weapons like different Aushadha yogas that break the chain of Samprapti. Aushadha yogas in general practice used to break the chain of Netra Yoga Samprapti. We can discuss in the coming hour. So the break the chain of Samprapti in different level. For that, how an Aushadha yoga can be used. In this presentation, I am trying to give some highlights, some directions, because in 1 hour or 1.5 hours, it is very difficult to express or difficult to explore the complete or Aushadha yoga. Even one part of the Aushadha yoga is very difficult, but some points, some highlights we can discuss. And now we are going to the real practice ground. We know in Uttara Tantra there are number of diseases, 76 in number, 94 in number, different types numbering we have done from Pakshma Yoga to Drishti Yoga and Sarvakshi Yoga, and its own Samanya Chikitsa and different specific formulations developed to handle the different etiopathological condition of ophthalmic diseases that we can see in the Uttara Tantra aspect. In real practice ground, we can get a single vyadi and number of vyadi. In our day-to-day practice, we can easily understand that. I am just giving some of the practical thing. So cataract, yes, everybody know. We know the line of treatment of Timira. If it is Vadika Timira or it is Paitika Timira or Kapaja Timira, we have a specific number of medicines, a specific number of therapeutic procedures we have done. But if it comes in diabetic patient, these all are simple situations I am just discussing in front of you. That is the cataract treatment, cataract in a diabetic, cataract treatment in diabetic patient. So there are Vyadhi Sankara we can achieve, and we have uveitis, and we are dealing in the name of different kinds of Abhishyanta, Syantarogas, and that pathology, the Abhishyanta pathology, everybody know it is having a prime, it's a prime concept in Ayurveda, Shalakya, Tantra, especially in Netra Yoga. So uveitis in a rheumatoid arthritis patient. So it's again the situation makes little modification. The treatment principles and the drug of choice or the formulation we are using to handle such condition make some modification due to this particular avastha. We can consider it's a particular avastha. Again, it comes different vyadhi sankaras in a particular thing. And paralysis, everybody know. So ptosis is a condition we know. So ptosis in paralysis patient, how to handle such thing. And pterygium, different kinds of armas we are getting as a single disease, independent diseases. And also if it comes in a regularly or chronic allergic patient, how the management principle will be and how we can select a drug or select a formulation to handle a particular such particular condition. And myopia, I think in this session itself recently you have concluded different refractive errors in last classes. So myopia is a condition everybody know, and if a chronic sinusitis patient with myopia, whether any relationship in this and how the pathological changes influence upon these two things, you have to think of such complex condition. And glaucoma, everybody know different types of glaucoma, and all Ayurvedists were dealing in different levels, primary open angle glaucoma or closed angle glaucoma, and different stages of the glaucoma, acute congestive phase and chronic phase, different stages everybody know. And according to Ayurveda, the concept of Adimanda, how the Abhishyanda is converting to Adimanda, and different types of Adimanda, the treatment management principles and treatment modalities. But if you consider a hypertensive patient in glaucoma, whether there is any link or anything to be rethinking regarding this. So diabetic retinopathy in dyslipidemic patient, and many other conditions like refractive errors in students, IT professionals, defense personality. So according to the occupational changes, how it is changing on the refractive error. So this is the real practice ground. When we are approaching a patient, many things will come. Not only a single disease entity, many things will come. So I am to identify that thing in the context of Ayurvedic Samprapti, how we can approach such cases, and how to model or how to design a Samprapti in that particular condition. And first modeling or designing the Samprapti to the particular Purusha or particular case, and then only we can start the Chikilsa, that is break the chain of Samprapti. So by stating these few words, I am going to some of the simple formulation which you all people are utilizing in your practices, and how it can be used in Ayurveda Netra Chikilsa. So these all are the Aushadha yogas in general practice, but these yogas having some specific action on the visual system or the Netra Yoga context. That's why we are discussing such 2-3 yogas only for the example purpose. This is one of such formulation. Kaishora Gulgulu Vadaka is one of the important yoga we can discuss. Nothing new in this, but if we understand the yoga in its depth, we can use in different levels of Ayurvedic ophthalmology practices. I think we can discuss about the Kaishora Gulgulu, the word Kaishora. Why this word Kaishora? So in one context it is saying that if the dosha is in Bahu dosha avastha, it will make the dosha into Kishora avastha, or the dosha Bahu dosha avastha or Madhyama dosha avastha. We can consider the dosha will be converted into the Laghu dosha avastha. That much capacity it Kishora avastha, making the dosha Pragopa into Kishora avastha. That is one of the action told to this particular yoga, Kaishora Gulgulu. And simply remembering or refreshing the ingredients, that is gulgulu, triphala, gulachi. This is the main ingredients. So the preparation we are using is triphala and gulachi. We will make the kashaya, and gulgulu is added to the filtered kashaya and boiled in an iron vessel. When the kashaya become concentrate, fine powder of remaining drug, that triphala churnam is there, gulachi sattvam is there, trikatu, vidanga, trivat and dandi. The powder of this one is added to this combination and stirring or churning, stirring well, and after touching with the grida, we can make the pill form, or it is converted into a mass form like the vadaga. Then it is easily. So in preparation, you can point out one thing: gulgulu shuddhi can be is essential, because gulgulu, as Comminivora mukul, is a resin, and as it's a gummy type, or we can consider that a sticky in nature. Many kinds of powder particle, different types of adulterant may be may be present in the market sample of gulgulu. So gulgulu shuddhi, there are 2-3 methods we are using in the practice to make the shuddhi of the gulgulu. The one thing is it's boiling gulgulu, tying in a clean cloth like a bolus, and prepare the triphala kashaya and boil it many times. Just keep it in the triphala kashaya 5 to 9 times, dipping in that triphala kashaya. That time gulgulu will be melted, and only the remnant parts will be there. Not only the triphala kashaya, in our traditional practice, Vasha Patra Kashaya is also using for the gulgulu shuddhi. So Vasha Patra Kashaya we will prepare, and the same the gulgulu will make the pottery, and we will dip in that kashaya, and the gulgulu shuddhi can be done. This is the preparatory aspect. As this is a vadaga, there is a vadaga, we can make the bolus of the vadaga. Now the Kaishwara gulgulu gulika is available. Kaishwara gulgulu tablet is available. So basically this is the preparation method, and this is the main ingredient. And regarding the pharmacodynamics, how it works, or what is the pharmacological action of this particular condition. It's a thick, particular formulation. It's a Tikta Kashaya in Rasa and Ushnavidya, and it's also having the Tridoshahara and Rakta Prasadana and Medohara property. So identify these pharmacodynamics in different ocular pathologies. That's very interesting. And by understanding that one, we can use. And Kaishwara gulgulu, as we are using in our general practice, in its yoga itself, it is mentioned, specifically mentioned, how it can be used in the Netra Yoga. So a specific Anupana is mentioned in the Kaishwara gulgulu yoga is Vashadi Kashayam. Vashadi Kashayam, if you use with Kaishwara gulgulu. And this is one of the specific action on the visual system or ocular system, how this Kaishwara gulgulu works. And we know that there are Pitta Anubandha or Pitta Kapha Anubandha, Vada Yoga and Vada Rekta also act as Rekta Shuddhigara or Rekta Marga Vishodhana is one of the things. Rekta Marga Vishodhana. As in the previous slide, I have mentioned that rheumatoid arthritis with uveitis, such conditions, that kind of situation, that kind of particular pathology, how we can make utilize this yoga with the specific anupana. There are different. So we should know the samprapti of Vadarekta, we should know the concept of Vadarekta, and we should know the avastha of particular Vadarekta, whether it is Vatadika or whether it is Pittadika or Rektadika, and Vadarekta is having different stages like Uttanakadam and Gambhira Vadarektam. Different sort of Vyadhyavasthas are explained, and when the patient is meeting you or consulting you at particular time, what is the correct doshavastha and vyadhyavastha he is having, and based upon that your selection of formulation will get a weightage or will get a fast action. How we can make Ayurveda drugs to be a fast acting formulations based on the particular time, a particular doshavastha and vyadhyavastha we are selecting, it will be it will act as very suddenly, and the result or dosha shamana or dosha Vaishamyan controlling will be very easier. So like that, Dattagata dosha pajana is one of the drug action we can expect from the usage of Kaishora Gulgulu. So Jirna, if you are facing the Dadu Gada Ama in Rekta Dadu and Jirna Rekta Pradosha Vyadis and Ama Vishajanya Vyadis, you know that the concepts of Ama is utilizing in the management of different netra rogas. If the condition is said to be the Ama, then the first line of treatment is Ama Pajana. Ayurveda Netra Chikitsa explained many things how to handle the Ama avastha of the condition, and sometimes this Ama will convert into Ama Visha and it will be more severe, and you can use in these particular pathologies this drug. You can select very randomly, and in the Palashruti there are 2-3 anupanas were specifically mentioned. In that Manjishtadi Kashayam, that will be discussed in later. Manjishtadi Kashayam is one of the main thing, and Ushnambu and Kshiram is one of the these all are the common anupanas explained in the usage of Kaishora Gulgulu. So if you go through the indication, therapeutic indication of this drug, yes, Kushta Roga is the, Rektavata is the, Vrana is the, Gulma is the, Prameham, Udaram, Agnimandyam, Kasam, Shwasam, Shoyatu, Pandu. These all are the therapeutic index of therapeutic indication of Kaishora Gulgulu, and in Netra Yoga it is explained in the in along with the Vashadi Kashayam, it can be specifically utilized for that. And you can see, if we use the Varanadi Kashayam, it will be beneficial for the Gulma. And the apatyas, some of the apatyas, while describing about a yoga, we need to understand the particular dosages and duration of the duration of that particular formulation. We can use some of the formulations have some limited days only. It may be mentioned in the yoga itself sometimes, and the apatyas and apatyas while taking that particular yoga, the amla tishna ahara should be avoided, and see the rosham, that is mental stress can be avoided while taking this Kaishora, and Shramam, Atapam, and Madhyam, alcohol usage, and Vyavayam, sexual intercourse. This should be avoided in general usage of Kaishora Gulgulu or whatever. So, how it acts on different levels, because these different levels are nothing but the Samprapti Gatakas we can consider, and the usage selection can be do. So it's a Tridosha Hara, we can easily find out. The action on dosha is it's having action on Vata, Pitta, and Kapha. And Dhatu, yes, two Dhadus, Rekta Prasadana and Medohara action is can be understand by giving the by giving the Kaishora Gulgulu. And on Agni, especially in the Rekta Dhatu Agni Pajana, we can use this Kaishora Gulgulu. And on Shrodas, Shrodo Shodhana and Lekhana property can be achieved by using this one. And on Trimalas, and its Vadanilomana and Vibandhara action is there. So Anilomatva can be achieved by this. On Yoga, it's a Vadarekta Shamana, a specific action on the Yogas, and it is Vranaropana, and it is Kushtatna, it is Vishatna, Krimitna, and Vishahar. It's a Vishatna. So this is the action on different yogas and different lakshanas. What is the difference between action on yogas and lakshanas? Because lakshana in the Shatvidha Kriya Kala, yes, the disease onset starts, Samprapti starts, and Samprapti develop into different levels. Sanchaya, Pragopa, Prasara, Sanasa, different Vyaktavastha, Vedavastha. So in some, if we will call it as yoga in the pure full-fledged form or in the Vyaktavastha. Before that, we can see different lakshanas. So it is in the journey of a complete pathology, or in between, if we can understand that particular avastha and that particular lakshana, if we handle it in that level, it may know Sanchaye, Apahurde doshe, Lebande na Uttaragadi, Tedu Uttaragadishu. That is, if we deal the yoga avastha in the prior conditions, that is in the primary stages itself, that time only it will be understand by the lakshanas. In such conditions, that is based upon analyzing what level that Samprapti now formed. By understanding that one, the action on lakshana, it's a Shula Prasamana drug. It's having the action of Pakahara. The Pachana is one of the things. So Paga, it will be change the Paga, or if the Shobha is the Shobha can be relieved by use of Kaishora Gulgulu. And also it's a Savakara in action. So this is the action on the lakshanas. And also in Prabhava, Rekta Prasadanam and Balavardhanam. This Balavardhana action we can see in different Vadarekta conditions. And you know the Samprapti of Vadarekta, Vayu Pravurdo, Vurdena Rektena Avarida Padi. And in many conditions of the eye, where the Rekta Dhadu, or in Padalas, where this Rekta Dhadu involved Padala, maybe involved in pathology, and many Rekta Dhadu involving condition. We can see where the circulation is affected. For example, we can consider the retinal vascular diseases like central retinal arterial occlusion, central retinal venous occlusion, branch retinal venous occlusion. These all are where you can consider the same pathological changes where some Rakta Patha or can be blocked due to the Vada Prakopa, the endothelial destruction. You can see in many conditions. So you just use the pathology, the particular pathology explained in that context, and which is one of the most useful drug in such kind of pathology that you can adopt to manage the different ophthalmic condition. Here I can share you one of my clinical experience with the Behçet disease, where I have used Kaishwara Gulgulu is one of the main internal drug to handle this condition, along with Panchadikta Kashaya Vasti, that I will discuss in later. So I think this disease, Behçet disease, Behçet syndrome, is characterized by different kinds of different types of ulcers, especially three different cardinal features. That is, one is mouth ulcer. You can see the slide, the ulcer in the tongue. That's a deep ulcers, abscess ulcers in the tongue. And also, ulcer you can expect in genital area, and also you can expect the ulcer in the eye, especially in the corneal, in this patient, corneal ulcer. So you can see this Behçet disease is characterized by a kind of rana, and the three cardinal features of this mouth ulcer, genital ulcer, and corneal ulcer. I can share is complaining of defective vision of both eyes, 15 years of duration, and on case of Behçet disease, and visual acuity is very poor, 6/60 on both eyes, and central field within normal limit, but electroretinogram examination shows the cone dystrophy of both eyes. So you compare this disease and the use of and the drug action of Kaishwara Gulgulu, and I got a qualitative improvement by using Kaishwara Gulgulu and the use of Panchadikta Kashaya Vasti. So I am going to the next aspect, and before going to that, the concept of Vada Shonida, the concept of Prana, where you can see Akshi Kutshi Bhavaroga, Pradishyaya Brana Jwara, Pradishyaya Brana Jwara, Panjaide Panjaratrena Pashamam Yadi Lankhanad, where in Brana and all this Vada Rekta condition, where Ama is playing a great role. You can see in the context of Samhidas, they have mentioned only the Vada Rekta, but the later authors like Madhava Nidanakara added a particular disease condition called Amavada. So if you go through the Charaka Samhita in Vada Rekta chapter itself, you can see an Amavasta is explained in that particular chapter itself. So that particular Samprapti, how it is applicable to the different ophthalmological etiopathogenesis that you can think of. By this, I am concluding the concept, concluding the drug action of Kaishwara Gulgulu Uliga. Then one of the important general medicine, where the eye ophthalmic indication is not given in the classical textbook, but in the general traditional practice, the older veteran Ayurvedic Vaidyas were used Triphala Gulgulu widely in the management of ophthalmic condition. But it is explained in the context of Bhagandara or the Gudaroga Prakarana. How here also the selection of this drug in the management of eye diseases is taken by understanding the samprapti of the disease, and how it is helpful to break the chain of this samprapti. That is the importance of a very simple formulation. I think many of these the doctors attending this discussion, they may be using this Triphala Gulgulu in their practice. So Gulgulu, Triphala and Pipali, very simple combination. And if we go through the pharmacodynamics, the Tikta Kashaya Kadajasa, Lakuruksha Sushma Gunas and Ushnavirya and Tridoshahara, especially the Kapavada Shamana, Medohara and Malanulomana, Medo Agni Deepana, these all are the drug action we are expecting in that. So by understanding this drug action or Rasadi Panchagam, we can use it properly to manage different eye diseases, starting from Pachma to different levels of drishti or even the retinal, different levels of retinal disease in different dimensions. We can use the Triphala Gulgulu. But its classical indications from Bhagandhara, Gulma, Shodha, Arshas. There is no mentioning of Netra Yoga, but it is widely used throughout India by the Vriddha Vaidyas of Netra Chikitsa. And yes, we can understand that it's having a rasayana property in our practical anubhuta practical experience. It's having a rasayana action, and also it's having a stampana action. So, by understanding the drug action and specific drugs, we can use it in Netra Chikitsa. I think everybody know the diabetic retinopathy condition, Prameha Janya, different Drishtigata Rogas, where the Prameha, the Samprapti of the Prameha, where the Kapha and Madas is getting more importance and is getting vitiated in the Vasti, and all the Saumya Dhatus were affected, and in later it may change to the Ubadrava in the Vedavastha, it may change to different acts on different marmas like Vrika, and that is in the form of diabetic nephropathy and different different rodhas in different sthanas, and it may if you go through the fundus examination, you can easily find out the different microaneurysm. There are different stages, as you may clearly aware that NPDR and the PDR level, and it's also in PDR in the high risk condition, including the severe macular edema, where where in PDR the severe loss of marked visual acuity loss may occur. So, in its first condition, microaneurysm. So, if we use the Triphala Gulgulu for long term, it can be used for long term. Usually, we are preferring a minimum of 90 days continuously for the usage of Triphala Gulgulu. Enhances the capillary microcirculation. How we can understand that one? Preventing the capillary occlusion. By preventing the capillary occlusion, retinal hypoxia can be resolved, or somewhat it can be changed, and neovascularization can be reduced, and it regresses the hard and soft exudates, and it reduces the retinal or and macular edema, and it improves and preserves the visual acuity significantly. Although this is not indicated in its classical reference, in our practice we can easily find out by taking a fundus image. You can see after the fundus image or fundus examination how the changes is occurring. You can see I have explained a karma of drug action of stambhana and on hemostatic conditions. Here you can see the bleeding in the retinal area, and this is a condition where the proliferative diabetic retinopathy of high risk category with diabetic macular edema, where the intravitreal Avastin injection is advised to the patient. And you can see the prescription. In that prescription, the left eye only counting finger is the visual acuity, and in right it is 6/9 partial, 6/9 partial, and also is having 18 years of diabetic history. And here you can see the prescription. In 2 and 3 you can see the Kaishora Gulgulu and Tribala Gulgulu. It is added in the management, and Guluchadi Kashayam and Nishakadagadi Kashayam. And you can see other two prescriptions like Mukha Changalyadi Guliga and Asana Murdadiana. One is a Murdadaila, one is a Praleba, and it is used to manage this condition. And the patient had the previous experience of Avastin injection many times, and again the manage repeatedly, frequently he is getting more and more bleeding tendency. And here the prescription we have given is Kaishora Gulgulu and Tribala Gulgulu. So it indicates that the Rekta Stambha, I have already mentioned the Rekta Stambhana property and the Rasayana property and other the action on the Kapha and Vada, and also it's giving the Medohara and Agni Dibana, because Medogni level Dibana is also, we can expect that Dhatu Agni Mandya is one of the important feature you can expect in the context of Prameha. So the Prameha Samprapti again moving towards eye diseases, Sendana, Abhishyanda in different level that may end up in the form of the Shobha is arising in the eye, arising in the retina. Later it may lead to Rekta sort of bleeding tendency inside that one. So in such condition, by the judicious use of this kind of medication, we are getting the visual, getting the stability of the condition, and also visual acuity can be improved by the use of this thing. In that prescription, 2 other things will be discussed in later, Mukhadi Pralebam and also Asana Murdadi Enna. How the total prescription only works. I'm not explaining you that single drug is what, but that total prescription, how to make the total prescription like that, by adding the needed tool to break that Samprapti. Then I can explain you the Dhanata Nayanadi Kashaya. I think it's also from the Sahasra Yogam, and in that Dhanata Nayana, Cisalpinia is the one of the important drug in that. Shundi, Shigrudasna, Ugraganda, Koraskalmas, Vairuna, Leshuna, Krishna, that is again Piperlongam or Pipali, Chitraga, Eranda, Surataru, that is nothing but the Devadaru, Ghana, that is Musta or Cyprus rotundus, Patya, Terminalia cebula, and Clerodendron serratum berbera. This is the ingredients of the Dhanadanainadi Kashayam. This is indicated in Ardidam and Aksheba Vadam. And is having the drug action of Vata Kabaharam and Deepana Pajanam and Shodha Shodhanam and Lekana action. You can see in different kinds of in Vadahada condition. We can Vadahada where the ptosis is occurring. You can use this Dhanadanainadi Kashayam as it acts on based upon the pathological change. You can make utilizing the Dhanadanainadi Kashayam in different ptosis condition. So, by explaining these 2-3 very familiar combination, I want to emphasize on this point, that is Shanadir Vyakhyavastacha Kalo Veshacha Yoga Krit. So, the how we can select a Veshaja according to the Vyakhyavastha. That is very important. So, understand the Lakshanas in different levels. We have the tool for Ashtasthana Pariksha and Dasavida Pariksha, and Ayurveda again focus that Purusham Samikshesham Dosha Aushadha Nirupane. In Aushadha Nirupana or the selection of the Veshaja, Purusham each different. It will be Vyadhyavastha and Doshavastha will be there. So analyze the Lakshana very properly and understand the dosha and dhadu behind that. Understand the Srodha Dushti in that. Understand the avastha of the Agni. Understand the avastha of the Sattva. Understand the bala of the patient, bala of the disease. All these factors are important. Then only we can make yoga. What is yoga? Yogam. The word Aushadha, I have only explained about the Aushadha. Osham Yoga Bhayam Jayati. What is yoga? Yoga is a very familiar word to Ayurvedists, and not only the Ayurvedist yogic practitioners. Most as in the Ayurvedic curriculum, yoga is also there. So yoga, the word, it is very familiar. It's familiar in the sense while describing about the Ayus, Sharira, Indriya, Sattva, Atma, Samyogo, Dhari Jividam. That's the word comes yoga, Samyoga. Sharirendriya, Sattva, Atma, Samyogo, Dhari Jividam, Nityagascha, Anubandascha, Padyayayuruchade. In that, Samyoga is coming. Indriya, Sharira, Indriya, Sattva, Atma. The yoga of this thing. Another yoga, we are very familiar that Kalatha Karmanam Yogo, Hina Mityadi Matragaihi, Samyak Yogascha Vijnayo, Yoga Arogya Karanam. Kala, Artha, and Karma is Hina Mityadi Yogas, especially in Nayanendriya. As we all know, Sarvendriyanam Nayanam Pradhanam and Nayanabala should be preserved very carefully. Yatnena Kurvida. Very carefully we have to preserve the Bala or Prasadatmakada of the eye. So, in that, Kala Vaigrida or Kala Hina Mityadi Yoga may lead to different diseases, or it may modify many of the pathologies. For example, Sushkakshibhaga, if it is in the Grishma Radu, there is an effect due to this Ushna Guna, due to this Tishna Guna, Ushna Guna, we have an effect on this Sushkakshibhaga disease. So, in Artha, usage of Nayanendriya in Hina Mityadi. How it is Hina Mityadi, I think everybody know. If we are using TV in a very dim light, that is considered to be the Hina or Mithya yoga. So like that, it's yoga and ayoga. And Kalartha karma, Kaiga, Manasiga and Vachiga karmas. It's also will affect the disease. So it's in there also. It comes the yoga. I am explaining the word yoga. Aushada I have already explained. Yoga. So this is one of the yoga. And samyak yogasya vijñeyo yoga arogya ega karanam. If it is in the asamyak avastha, dosha vaishamya will be effect. And if it is in the samyak avastha, the dosha samya will be, or arogya will be the thing. Then in the yoga shastra, yoga chitta vritti nirodhaga. Chitta vritti nirodhaga. It's one of the definition. And yoga karma sukaushalam is another. It indicates, even though it is explained in the context of a yoga shastra, karma kaushalam, in the context of aushadha yoga, we can say that it is the quality and safety of the drug. And this chitta vritti nirodhana, that is controlling over the chitta vritti, because there are two words, adi and vyadhi. Adi comes from the manobhava, and if the adi is converted, then the vyadhi sharirika avastha may be arise. So while making the yoga is nothing but the integration or the combination of many factors. So in a drug formulation, how we are making a combination, a yoga, and how is making a yoga with its anupana, and how this drug formulation acts with the different aharas, the drug food interaction, how this formulation acts with different viharas. I think you may remember that in Kaishwara Gulgulu, Vyavaya and Rosha is contraindicated. It's explained in that particular formulation. So again, even the mind level restrictions to improve the potency of a drug, how to keep a condition inside the body, that is the pharmacokinetics, inside the body, how we can make a yoga, proper yoga to get the target tissue, the vitiation in the particular cells or a particular asthanas or avyava, how we can reach. For that, this yoga, the integration in the proper avastha is needed. So thus we can, Chavana Prasha is a yoga, Dashamularishta is a yoga, the combination of different drugs. Then you can understand that what is the difference between a Gana and a yoga. So in Gana, many similar qualities, similar gunas can be grouped to make a Gana. But in a combination, the Vishesha Prayojana, the integration of all other Rasadi Panchaga to make a Vishesha Prayojana, that is the therapeutic index we can. So in that, identifying that therapeutic index, there is a practice that you might have known, that how to understand the therapeutic index. If the dosage to produce a toxic effect divided by dosage to produce a desired effect, if it comes 10 and more, is one of the method of identifying the therapeutic index according to the modern pharmaceutical. In the same way, Ayurveda also giving a direction how to understand different types of therapeutic index. So Vishesha Prayojana or Vishesha Guna analysis will be there in a yoga. It is something different from the Ganas. we have a Chakshushya Gana, we have Jivaniya Gana, we have Negryodadi Gana. If we are using it in a yoga by making some other thing, we are analyzing in different level of that combination. So I am moving towards the next point. You can see this is a Malayalam slogam. Pippali nalla muttanga manjalum maramanjalum. I will explain the meaning. Pippali, everybody know is Pippali. And Mutta, Musta. Next one is Musta. The third one is Haridra. And fourth one is Darbi. These four drugs. Four drugs. Pippali, Musta, Haridra, and Darbi. If it makes paste and apply on the breast of mother, and you can feed to the children to manage different Sendavasta of the Arachu Mulamel Techi Tapilla Kukodukanam. It's a prayoga in the pediatric practices, especially in different kinds of inflammatory changes occur in the eye or different Sendavasta in the eye. There we are using Pippali, Musta, Haridra, and Darbi, making the paste and apply over the breast of the mother and making the giving the feeding to the infants. So starting from 10 days to 102 year, we can have the spectrum, and we should redesign the formulations according to different age. We have to redefine the dosage, and to redefine or modify the practices also. So I can remember one of the basic directions from our Shastrarthan Vyabhino Vidyat Prayogam tu Egadeshikan. So the practical approaches you can develop. If we go to different part of India, ophthalmology practices are there in everywhere in different levels, all in different rural area, in different state. You can see some practices. Maybe the prayoga may be different, but the fundamental concept will be one and the same. And usage of medicine may be different, but a concept will be there on the dosage. Concept will be there on the particular formulation. The Panchavida Kashaya Kalpana and Upakalpana, how it is modifying. All these things we can use, and it can be used from infantile period to a geriatric or the complete protection we can give by using different formulations and therapeutic procedures. In the same sloka, you can see different mentioning about a different Murti Daila, Talakku Tepa in the sense Murti Dailas, and Manjishtadi Enna. It is Manjishtadi Enna, Tripaladi Enna. So Tripaladi Taila, Manjishtadi Taila, Asana Vilwadi, Chandanadi, these all are considered to be, it is a reference from the Sahasra Yoga. It's using in different levels of pathological changes in the eye. As I have explained, the Asana Amradadi Enna in the diabetic retinopathy cases, it is highly effective to manage the bleeding condition, and also it facilitated the good dosha samyada, especially in the diabetic retinopathy condition. I think you may remember in the previous prescription, you can see that Asanamradadi Enna in diabetic retinopathy condition. So now I am moving towards some of the common dravyas everybody know regarding the these dravyas, and we are using in different netra aushadha yogas. And this table is particularly for understanding the ocular analgesic or the pain management in eye. How our classical text approached each dravya to attain a particular karya. Our karya is Vedana. As you all know that Vyadehe Tattva Parijnanam, that is nothing but the understanding the principles of the disease or how it is manifesting. Vyadehe Tattva Parijnanam, Vedanayascha Nigraham. After identifying the correct principle, how to relieve that particular Vedana. The Vedana is nothing but the disease itself, and Vedana, literally we can say that the pain. The pain, I think the word pain is coming from a Latin word, poina. Is poina. The meaning of that poina is punishment. So the Vedanayascha Nigraham. Vedanayascha Nigraham. Managing the lakshanas or reducing the Vedana. Edat Vaidyasya Vaidyatvam. This is the quality of called Vaidyatvam. Understand the Vyadi first. Understand the pathology. Understand the Vyadi. Understand the complete Nidana to Nidana Panchaka of the disease. Then that is the Vyadehe Tattva Parijnana. Then try to manage with your own weapon, different dravyas, different adravyas, how to handle that dosha vaishamya, that srodha vaigunya, how to relieve. This is our tool. This is called Vaidyatvam na Vaidya Prabhurayusha. And we know that this is a highly practical science. We know that the Vaidya is don't have any control over the Ayus. Na Vaidya Prabhurayusha. We are not the Prabhus of Ayus, but we are trying to understand the Vyadi. We are trying to make the Vedana Nirharana, and we are trying to achieve the Vaidyatva in our life. That is our aim. So in that context, how to manage different kinds of pain. I think you know that in Netra, while reading different formulations, you can Ruk, different Toda, Shula, Garsha, different types of the pains were explained in different context. So here I am explaining about some common dravyas which are having the karma of Netra Rujahara. But that Netra Rujahara in different contexts, according to the different dravya, Acharya used different terminology. So that also you have to make in your mind. That's why I kept the action of these drugs particularly to the explained in the classical, that is from different Nigandu, Bhavaprakasha Nigandu, Raja Nigandu, Dhanvantari Nigandu, from that point to different our classical text here, the Vedana management drugs or ocular analgesic we can easily say, and the same drugs in different other action mentioned in the classical text, and we are trying to analyze the Rasadi Panchakam of that and how we can utilize in different yoga. This is the next exercise I am going to deliver in this particular session. The Darby is one of the important drug used in many ophthalmic formulation. Berbers aristata is Darby. And in classical text, you can see that Netra Rujahara is the specific action attributed to Darby. And not only that, some added actions, karmas, you can see. It's Akshidoshahara. It's Netriya. Netra Kanduhara. We should concentrate on all these terminologies. What is the difference between Netriya and what the meaning of Akshidoshahara? What is Netra Kanduhara? Netra Kanduhara is directly you can understand that one. And this Darvi is having Netra Rujahara property in particular, because in this slide, 2-3 slide, I will concentrate only the medicines having that particular clinical action. So here you can see Tikta Kashaya Rasas, Rucha Laguguna, Ushna Virya and Kadu. This is the Rasadi Panchagam of the Darvi. We can move on to the Bringaraja. It's the same word used by Acharya in the classical text, Netra Rujahara. This also, it is nothing but Eclita alba. And the other action identified or they highlighted is Naktantya, and it is a Chakshushya. Action is there. Here you can see the Kadutikta Kashaya, Kadutikta Rasa, Yukshalya Gutishna Gunas, Ushna Virya and Kadu Vibhaga. Again, Nimba, Asadiracta Indica, Netra Badahara. This is the word used. The meaning is nothing but the pain relieving. But the word used is Netra Badahara. And again Netriya, as in that of Darby. And Netra Kanduhara. And one other addition is Netra Shodhahara. Netra Shodhahara action is attributed to the Nimba. See, Tikta Kashaya is the Rasa, Guna is Laku, and Virya is Shita. And Kadu is the Vibhaga. We are moving towards another easily available drugs, Shigru, is Moringa oleifera. And here mentioned Ashru Vedanahara. See, Netra Badahara, Netra Rujahara, Ashru Vedanahara, and Chakshushya. And here Navadrik Kobo. See, it is Purana Rogas are there, Nava Rogas are there, or Taruna Rogas are there. So here Navadrik Kobo, the recently vitiated Dosha Prakopa, that specifically explained regarding the Shigru. And also Sleshma Abhishenda Nasanam. It's particularly for Abhishenda, everybody know. Sleshma Abhishenda Nasanam. Again, you can see the Kadu Dikta Rasas, Yukshalyagu Uthishna Gunas, Ushna Virya and Vibhaga Kadu. And Manjista, it's Rubia cardifolia. This is one of the wonder drug we can use to manage many severe painful pathologies of the eye. If we use the Manjista with Ajachira Paga, and we can utilize for the Netra Dhara or Patta, keeping the Netra Patta over the or Netra Piju over that. This one. Akshirukhara is the word mentioned, and it's having Madhura Kashaya Tikta, Rasa, and Guru Ruksha Gunas, and Ushna Virya, and Vibhaga is Kadu. And Manjista you can use, and even if you go through the Manjista the Kashaya, internal Kashaya, mentioned in Sahasra Yoga, especially indicated in different ocular pathologies, especially in different Sienta avasthas and even in the bleeding conditions. So even in Pillarogas, due to different kinds of pain will be there also the Manjista, the Kashaya plays a role. So Manjista, this is here I am explaining the particular drug, not the combination. And you can see the Haritagi terminalia cebula is Netra Rujapa Harini. Akshirukhara, Ashruvedanahara, Netra Rujapa Harini. And Chakshushya, Netramayakni, Akshirogahara. This is the total action explained in other contexts regarding the Haritagi. So we all know that in the different inflammatory eyelid diseases, the tender fruit of Haritagi, if we do the praleba with Ushnambu, or sometimes if we do the praleba with Tulasi Swarasa, it may give good relief even in the pain, and also that particular inflammatory eyelid diseases, that thing may be controlled by the use of tender haridagi. Why I am mentioning is that even the stage of a fruit, stage of a particular thing, the particular in moringa, you can shigru pallavam, that is the very thin or very primary edge of that leaves we are using for shigru pallavam samakshigam. It's explained for Anjana shigru pallava swarasa, if mixed with honey, apply over the apply as anjana to it's explained. So the stages of a particular, we are the useful parts, sometimes the roots, sometimes the bark, sometimes the leaf, sometimes the fruit, but that also Acharya specified the particular, it should be used in the tender form, it should be used in the ripened form, it should be used in different so stages of selection of drugs according to its own particular usage part, and also in you know that Rudu Haritaki, different from which season you can collect to get the maximum potency of the drug action. So like that, there is a direction from our science. So just I am reminding such points along with that. So we are moving towards other dravyas like jadi. It's again jadi is nothing but jasmine and grandiflorum. So jadi muguladivarti, you may be knowing that jadi muguladivarti for using for different kandus and different vatma yogas, the anjana application of that varti, and you can show if that Akshir Jahara is there, you can make utilize and you can, if you go with the particular combination by this outlook, you can get more and more therapeutic index, and you can utilize in the pinpointing clinical condition. That is the that is the need of explaining this thing in this particular context. So Chakshusham is again Chakshusham and Tikta Kashaya Rasa and Laguguna Shida Virya and Kadu Vipaka. Another one, Pongamia Pineta or Karanjam. Nayanarthi Nashanam is explained. These all are different types of the pain management or the drugs which are using for the pain management. Chakshusham and Nayana Pushpakrit. See, like in different opacities. Here explained about it. So you can understand that Nayana Pushpakrit. So you can point out that the drug action you are expecting in the Krishna Mandala level. So by understanding the in-between lines of the particular terminology, you can understand up to what level this drug can work. Up to what level this drug can. So Nayana Pushpakrit. So the rasa, Katutikta Kashaya rasa, Lekutishna, and Virya is Ushna, and Vipaga is Katu. Guluji, it's Phenospora cordifolia. Netra Vyatahara, it is explained. In that particular pain management, it is Netra Vyatahara. So I think in Vadavyadi, you might have heard Toda, Nistoda, or Shula, different Ruja. These all are different levels of dosha prabhava. Even though the word meaning is one and the same, so it is in different degree of vitiation or degree of pain grading you can consider. So that's why this particular terminology is significant, and it's having Chakshushi action, Shukla Krishna Gata Yogas, so Arma, Mera Kacha, Linkanasha, and in Pillavatma you can use Guluji, and Tikta Kashaya Rasa is the main rasa, and Guru Snigdam is the main gunas, and Ushna Virya and Madhura Vibhaga is the main Rasadi Panchagam. So this is about Tinospora cordifolia. I have personal experience that another variety, Tinospora crispa, which the decoction of the Tinospora crispa, there is some thorny projections will be there in the stem of that particular variety of Tinospora, that is called Tinospora crispa, and it is highly effective in vaginal hemorrhages, and we are getting good result even in the hemorrhage condition, and visual acuity can be improved by use of that Tinospora crispa. So these vary: Darbi, Bringaraja, Nimba, Chigru, Manjishta, Haridagi, Jadi, Karanja, Puluji. 9 drugs I have explained. So here you can see that most of the rasas are tikta. Most of the rasas are tikta, and most of the gunas are lagu, and most of the vibhaga is kadu. All this we can consider that it is vadakara. It's vadakara in nature, but we are getting the vedana shamagatva by using all these things. One thing is most of the viryas explained in this drugs are Ushna Virya. So I can give you one concept that Rasam Vipagasto Vidyam Prabhavastanya Bohadi Balasamye Rasadinamiti Naisargigam Balam. So here you can understand that with the usage of Ushna Virya, so the Vedana not only related to the Vada will be the prominent one, and sometimes Pitanubandhatva will be there, sometimes Kabhanubandhatva Vedana will be there. So in this context, the Ushna Virya plays a major, you can see, if you analyze the drug in particular thing, if Rasa and Vibhaga is there, Vibhaga works well. And if the Rasa, Vibhaga and is or in action, Virya will be in more action. If the Prabhava is there, Prabhava will be in more action. So this is from the Ashtanga Hridaya. So this I have kept just for the example purpose. Like that, you can understand even the even the mineral drugs like Swarna, Rajata, Swarna, different things like Yashada. We are using different types of even Spadiga, different types of minerals and other metals we are using. In the Gairiga is one of the main drug we are using, and different types of Kasisa, Tutta, all these drugs, and I can remember everybody is using Jivandyadi Grida as a netra prasadana, or it is a very useful in the management of different kinds of thimira, and also in different kinds of refractive errors. And many of the Vriddha Vaidyas were using a gold is rubbing in the Jivandyadi Grida, and they will apply as Anjana. So how to make the synergic effect with all these minerals and metals that we can do. So in this context, I am just simply giving some direction regarding that. You can see different angles in the classical textbook, and here I am going to start different yogas. That also very 2-3 for the model purpose. Why? Because how to understand each and every Sega. Why I started Sega in the sense in Netra Chikitsa, Sega, Praleba, and like kind of therapies are useful in the Amapajana purpose. So these kind of Sega yoga, Sarvesham Akshiroganam Ado Ashodanam. This Sega, Ashodana and Sega is very closely related. The modified form of Ashodana is the Sega, we can consider. So, I can give some references from Chikilsa Manchari. So, there are different classical Samhitas and also different regional books, famous regional books like the Sahasra Yogam, where thousands of drug formulations are explained as a researched research samhita by different generation, and also Chikilsa Manjari, Vaidya Tarakam, different kinds of regional textbooks are available in Kerala and also in different in Karnataka and also in different part of India, North India. There are some specific work they have conducted by their own observation and research, and they have concluded some of the yogas as very useful in managing some of the conditions. So, like some yogas, I am just giving some guidelines. It's from the Chikilsa Manjari. Avanakadisekam. Avanak is nothing but the Eranda Moolam, and Cheruchira or Tanduliyaga is the seeds of Tanduliyaga can be used. Ichu Moolam is Amalaki, Guluchi. These are the 5 drugs used in the this Avanakadi Segam, where the kashaya you can decoction, you can prepare from the and you can use for Netradhara. It's indicated in Vadaja, Netra Vigara in general, and in Mridhiga Disegam. This is also from Chikilsa Manchari. Mridhiga, Yashtimadu, Devadaru, Chandana, Musta, Ugraganda, Triphala, Lodra, Darvi. The Sega prepared out of the decoction prepared out from this combination you can use in the Pittaja Netra Yogas, and Triphala Segam. Here I am pointing the preparation also, because the other two one are simply making the decoction. So Triphala Segam, Triphala Kadakena Samyukta. So here you can see Triphala, Kataka, Yashtimadu, Devadaru, Haridra. Triphala, Kataka, Yashtimadu, Devadaru, Haridra make the kalka of the above drug mixed with tender coconut water. You can see Salile Tungadrumo Vipachitam, Vipachitam, tender coconut water, and make a decoction and used for the segam after filtering. This can be used in Rekta Dushti, Daha and Ruja. So this is one yoga for Vada. Generally we are speaking Vadaja, and this one is for Pittaja, and this one Rekta Dushti and Pitta Rekta Dushti we can point out where the medium is not the water, tender coconut water is used. So come in the same way, different types of kashayas, that's Yashti, Amalagi, Padola Kashaya with Saindava Levana in different inflammatory swelling, eyelid swellings we can use as Dhara or Netra Sega. And this is another one. In Netra Pagam, Nellitoladi Samsegam, it's the Amalagi, Guluji, Ichu, Ushira, Lodra, Marija, Darvi, Kataka Kashaya with Madhu, making the decoction, add Madhu, do the Sega. That is for Netra Paga, different Pagas. So this is called Nellitoladi Samsegam. And not only that one, Deshamula, Tribala, Kshira Paga in Vadajatimira, and Darvi, Tribala, Kataya Sega, and Darvi, Kshira Paga Sega in Abhishyanda, and Eranda Mula Kashaya with Madhu in Netrashula particularly, and Yashti Kshirapaga with Sarkara. It is indicated in almost all Netra Yoga, Nayana, different types of Nayana Yogas, and Musta along with the Stanya for watering of the eyes, Stanya. Ajachira with Draksha Tribala Yashti is for managing different Nayana yogas, and you can get a reference from Chikilsa Manjari that Darvi Valkala Nishkwado Madhuna Ashtamamsha Sheshide Sarvadosha Pragopedam Jed Nayana Vaikriyam. So, how we can prepare the decoction? Here it is Madhuna Ashtamam Madhuna Ashtamsha Sheshide. Ashtamsha Sheshide. So here you can take as a direction from the Chikilsa Manjari how the decoction can be utilized for the Sega yogas. And I am moving towards after the Sega yogas, Praleba yogas. Because Bidalaga, for different Bidalaga. This we can say that modified